Hi, everyone. My name is Annalise Poets, Senior Program Manager, Knowledge Mobilization for Social Innovation at Brain Canada. Welcome to this edition of Dementia Talks Canada, presented by the Alzheimer's Society of Canada in partnership with Brain Canada. It's my pleasure to be moderating this talk today. We just need to go over a few housekeeping items before we start. This session is being offered in both English and French. To select a language, you can click on the interpretation button at the bottom of your screen and then choose the English or French language. You will also notice that throughout the session, poll questions will pop up on your screen. We ask that you answer those whenever possible to help us make future talks even better. This session is being recorded, but please note that only the video and audio of the panelists and the moderator is captured in the recording. Questions can be sent to our panelists through the Q&A feature on your Zoom control panel. If we don't have time to answer your question during the live talk, staff from the Alzheimer's Society of Canada will answer your question by email in the coming days. Next, I'll go over a bit of information about the organizations partnering to host these monthly webinars. The Alzheimer's Society is Canada's leading nationwide health charity for people living with Alzheimer's disease and other dementias. As a national registered charity, Brain Canada Foundation plays a unique and invaluable role as a national convener of those who support and advance brain research. Before we get started, I want to acknowledge that the offices of Brain Canada Foundation are located on the traditional, ancestral, unceded territory of the Ghanaian Gahaga peoples, a place which has long served as a site of meeting and exchange among nations. We honor and pay respect to elders past, present, and emerging, and dedicate ourselves to moving forward in the spirit of partnership, collaboration, and reconciliation. In our work, we focus our efforts on the Truth and Reconciliation Commission's calls to action, numbers 19 to 24, that pertain to improving health for Indigenous peoples, and on number 57 that focuses on advancing our own learning on Indigenous issues. Our team is sharing a link to all of the calls to action in the chat right now, and we urge you to take a look at them. Now, today's webinar is about brain injury and dementia, and I'm honored to be joined by three individuals who bring unique perspectives and knowledge to this topic. Dr. Shalina Babool is Associate Director of the BC Injury Research and Prevention Unit at the BC Children's Hospital, and is also a clinical professor in the Faculty of Medicine at UBC. Dr. Babool specializes in traumatic brain injuries and their prevention, recognition, treatment, and management. She also examines trends and patterns of concussion in BC and ways to raise awareness about brain injury. Tim Fleiser is Executive Director of Concussion Legacy Foundation Canada and is former Canadian Football League player. Actually, he was the first player in Canadian Football League history to win 4 Grey Cup championships with 4 different teams. His organization has a mission to support athletes, veterans, and everyone affected by concussions and chronic traumatic encephalopathy, a condition which can lead to dementia. Dr. Carmela Tartaglia is the Marion and Gerald Soloway Chair in Brain Injury and Concussion Research at the Krembil Brain Institute in the University Health Network. She is also Associate Professor at the TANS Centre for Research in Neurodegenerative Diseases at the University of Toronto. She is a cognitive neurologist who sees patients with neurodegenerative diseases and those with persistent symptoms after concussion. Thank you all for being here. Let's get the discussion started. So we know from fairly prominent research that traumatic brain injury in midlife can increase a person's lifetime risk of dementia by an average of 80%. But there's still so much that we collectively don't know about brain injury and dementia. I myself have been working on a project at Brain Canada that involves interviewing many people across Canada with diverse perspectives on brain injury. And a common theme was how little we know about the brain. And people also mentioned being worried about their risk of dementia after their brain injury. So to start off, I know our audience would love to hear what you think is the top thing Canadians should know about the link between brain injury and having a higher risk of dementia. Dr. Babool, would you like to start us off?
Sure. Yeah, there's a lot of misconception out there still today in terms of concussions and equating it to a brain injury. You know, the old adage that you just had your bell rung still seems to resonate out there. Now, having said that, we've come a long way in the last 10, 12, 14 years, but we have a long way to go. A concussion is a brain injury, a mild traumatic brain injury that needs immediate recognition and appropriate management to avoid long-term complications and post-persistent symptoms. So if you think about it this way, your brain is really your information highway, processing information at speeds of 250 miles per hour. And when there's a potential or suspected concussion, there's a sharing or tearing of the axons or the neurons of the brain, and which need time to heal so that information can process as it would normally. And I usually give the example of an earthquake. When cars are driving on a road, there's no issues. You can, unless there's traffic, you're moving at regular speeds. But when there's an earthquake, there's tearing or fractures in the road that need to be repaired before those cars can proceed through. And that's what happens to the brain. There is a shearing and tearing of the neurons, causing a backlog of information, which results in the symptoms that appear, whether that's headache, fatigue, sensitivity to light, sensitivity to noise. And immediate recognition is the key, and physical and cognitive rest for 24 to 48 hours, followed by slow, active integration back to activity as tolerated. And we recommend a 6-stage return to activity protocol. So that would be my initial thoughts, is immediate recognition is the key, and recognizing it that it is in fact a brain injury.
Okay, and Dr. Tartaglia, what would you say to this question?
Yeah, I have to agree with Dr. Baboul that, the most important thing for people to recognize is that it is a brain injury. And secondly, to recognize that as unromantic as it seems, your brain actually defines you. And so it's, completely conceivable that a person who sustains a brain injury, even if it's considered mild, and one of the people I work with is really opposed to that term because it makes it seem like it's so benign, but it's a brain injury, and a brain injury will affect who you are. And so, we often hear I see people who have persisting symptoms, and, their families are saying, they're nothing like they used to be, and while their brain is recovering, that really is the truth, that there are changes, and we don't, there's so much we don't know. We don't have any idea what the pathology is. So, although people talk about tearing and shearing, we don't have any evidence of that in a concussion. Some of us think maybe there's a neurotransmitter problem that happens afterwards. So a lot more research for this, for all brain problems in general, because there has been a lack of research in this area, and we have not been able to make the headway that cancer and heart disease has made. But we need to understand that when you have a brain injury, no matter how mild, it is, that it will change you. And that we need to deal with that, because people can have persisting symptoms for months and sometimes even years. Largely we don't think this is a irreversible condition, but there is this evidence that even one injury can increase your risk for dementia later on. And so understanding what that link is really important. But in the here and now, really treating the symptoms that people end up with because of this injury is really important.
Thank you so much. And before I move to Tim, I just wanted to ask if there's anything else that either Shalina or Carmela wanted to say about the link between brain injury in midlife or even at a younger age and risk for dementia.
I don't know I can start. I think people have to be careful about the word risk. If you look at so concussion, even mild traumatic brain injury, all more severe brain injury has made it to the list of the 12 modifiable risk factors for dementia now. Okay. But on that list, you have to look at what else is there. And, air pollution is there, loneliness is there. And then there's high blood pressure and inactivity and, alcohol. And so I think what you have to think about is if you have something or something has happened that increases your risk, you have to double down, and work hard at the things that could decrease your risk. And so there's lots of modifiable risk factors. And just because a concussion has happened to you does not mean that you will get dementia. It does not mean that at all. And I think that there's a concern that people have, and the anxiety associated with that is really quite terrible for some people. And I always tell people, you have control over some of this. There's a lot of those modifiable risk factors that we can do something about.
Yeah.
I'll leave it to Dr.
Yeah, no, I completely echo Dr. Tartaglia's comments. We've come a long way, as I said, in understanding that concussions are a brain injury. It's not just having your bell rung, but we have a long way to go. I mean, this injury is so precarious. It's so insidious. No two concussions are alike. Everybody responds differently. Why do some have CTE? Why do others not have CTE? So there's all these unknowns. But at the end of the day, if you can you modify your risk factors from the prevention stage, primary prevention, as easy as wearing preventative equipment to mitigate the severity of the concussion. I think that's what Canadians need to recognize, is that it is in fact a brain injury, but there's things you can do to mitigate your severity and long-term consequences and quality of life.
Great, thank you. Tim, what would you like to add to this?
Well, yeah, I think it's important to say that these things are likely related. And in some cases, looking at the brain injury, particularly our work in sport, some of these injuries are preventable. And so we'll talk more later on about what that means, particularly for children and their sports participation. But I think whether it's you played sports, whether you served in the military, whether you're an accident survivor or a survivor of violence, just knowing that there is an increased risk if you've been exposed to brain injury, I think is important. And then thinking about, to echo Dr. Tartaglia's point, there are things you can do right now. And, there's no magic pill, but we talk about Operation Brain Health for our military, which the 4 pillars are exercise, diet, sleep, and building cognitive reserve by doing things like reading and playing chess and playing music and things that stimulate your brain. And so, if you're concerned about your risk, there are things that you can do right now that will help mitigate that.
On to our next question. Thanks so much, all of you. The next question is about what each of you have learned from either your experience or your work or anything you've read about the latest research that has surprised you. Dr. Tartaglia, did you want to start us off?
Sure, thank you. I think that's a great question because there's, I think the brain and brain injury is a very exciting field. And there's, we've already all said that there's so much more to learn. But one of the things that I have learned in my research program, and Dr. Baboul already alluded to this, is we actually have proof of this heterogeneity that we talk about. So, when we say, if you've seen one person with a brain injury, well, you've seen one person with a brain injury. It's very difficult to generalize. When you look at the vast array of symptoms that people end up with, it's like close to 50 different symptoms, all these different clusters. And so it isn't an easy condition to treat. And, what we have already, we felt when we see these patients is that there's such heterogeneity. And we actually looked at, these, the connections in their brain. We have functional connections and we have structural connections. And by putting these two things together, we could see that there were 2 populations identified. And probably if you have more patients, you could see even more different, like more populations. But we could see that one population their connectomics were very similar to the healthy controls. They had symptoms left, but their connectomics were similar to the healthy controls. And in one population, they were actually quite different. And when we compared these two, we could see that the patients who are very different in terms of the connectivities of their brain, they had more depression, more anxiety, and more aggression. And so, we're starting to, I think, move towards this personalized medicine, this precision medicine that, people who have cancer recognize. They know that, people want to really drill down and say, yes, this is what you have, and this is the therapy we're going to target you with. But we haven't been like that. And I think, realizing that this is possible, this is conceivable, and that, this is going to be the way forward for our patients. I think I'm very excited about that.
Can you explain a little bit more about what connectomics is? I've never heard that word before.
Yeah. So when you think of our brains, we often think of one area of the brain, but really the marvelous aspect of our brains is all parts are connected to other parts. And that's how things get done, right? Like the cells have to talk to each other. The different parts of the brains have to talk to each other. And there's different ways they connect. Sometimes it's just kind of like in a rhythm. Sometimes it's actually physical connections. And so we have new imaging tools that can study this, that can really get at this better. And so even though it's not like your standard clinical MRI, which, is very good and can rule out a tumor or bleed, but doesn't really get down into the nitty-gritty of this aspect. But we have a lot of new tools available, and not just in imaging, in biofluids. We have a lot of new tools that are going to be able to, make us more precise and accurate about diagnostics. And so these tools are really about looking at only at connections. The brain looks great, but there might be something different about the connections.
Interesting.
Yeah.
Yeah, thank you so much. Dr. Babul, what would you say has surprised you recently?
Yeah, concussions are not a black and white injury, as we've alluded to. It's a whole lot of gray, because no two concussions are alike. Nobody, you can have someone who takes a significant hit, say head to head in soccer, who is completely fine the next day, versus someone who just hits their head taking out the groceries from the trunk of their car, who is having persistent symptoms months on end. So there's so much we don't know, but trying to get Canadians to really take this particular injury, it's very challenging, and trying to change the culture, trying to change behaviors and attitudes and practices. We're getting there very slowly, but we have certainly a long way to go for people to really recognize, you've only got one brain, and it's the organ you can't transplant, right? As I said, it's your information highway. So trying to change the myths around it, trying to increase recognition, trying to change behaviors. I had a coach say to me, my responsibility is not for the safety of my player. My responsibility is to put out a winning team. And it's those attitudes we want to change. And, that's the challenge that surprises me, is that people don't recognize how important and fragile the brain is, and the need to really heed the warnings that are out there.
Great, thank you. And Tim, what has surprised you recently?
So it was actually about a year and a half ago. Some of my staff came to me, and I've been around this issue for more than a decade. And it's actually shocking, the little amount of research that actually has been done on female brains in this issue. The vast majority of our research has been on males and has been on male brains. And, again, particularly our work with female veterans here in Canada, we were one of the first countries where women went into active combat. And what that means is they also participated in training, which is where you see a lot of the brain injuries happening. And so we now have a cohort in Canada of, women who are in their middle age who are starting to present with many of the same symptoms that we're seeing, in male military members and some of our athletes as well. And, just echoing what Dr. Babel said, there's so much more that we don't know than what we do. And it's even worse when it comes to women. So a couple of years ago, when my staff brought me to this, we were fortunate to have Erin Ambrose, who plays for the women's national hockey team, who pledged to donate her brain as part of International Women's Day to try and bring attention to this issue. And I will say the optimistic news is that we've had many Canadian brain pledges to get studied, and that even more women than men have signed up at this point. So I feel like that's something that can and will be corrected in the short term.
That's really interesting, Tim. I have also heard in the interviews that I've been doing that there's very little known about the female brain as opposed to the male brain. I just wondered, Dr. Babul or Dr. Tartaglia, do you have anything to add about that, about what's known in research, and why is there sort of a bias towards research on men as opposed to women?
Yeah, that's a great question. And, a lot of what we actually know right now isn't completely accurate because for the most part, a lot of the research was done on male athletes. And so it's not just that it's not accurate for females because they weren't even represented in the research, but actually it's not that accurate for males too, because it was a very select population, right? And we now know that, there's lots of diversity issues when it comes to studying, biology. And so there's a lot of our population that have not been represented in past research. So yes, lots to learn. And, we don't understand right now. There's a lot of hypotheses of why women seem to be more at risk of having concussions and more at risk of persisting symptoms of concussion. But I think this is going to be a very rapidly evolving area in the next few years.
Agree. Yeah. And it's great to see that we're breaking down those barriers and moving to a more diverse population, to gain that knowledge that's been lacking for all these years. So it's really good to see.
Wonderful. Thank you so much. And now it's time for our final question before we move into our audience Q&A. So to the panel, is there anything else you think Canadians or our government leaders should know in terms of brain injury and dementia? So it could be prevention of brain injury or prevention of dementia or both, or it could be changes to policy that are needed or anything like that. Tim, do you want to start us off?
Yeah, so where we see a lot of brain injuries happening is certainly in sports participation. And what the data is very, very clear, which is that exposing children to concussive and non-concussive impacts is not a good strategy in terms of their long-term health. And remember, CTE is a brain disease that's 100% preventable, right? And so, when we look at policy, certainly football and hockey have gotten a lot of attention, and, removing body checking and tackling for participants, certainly under the age of 12, and we recommend 14 to be on the safer side, I think is a very important policy change. Hockey Canada has actually been good on the issue where they put in restrictions on body checking going back to 2013. We've been in discussion with Football Canada and the provincial sport organizations about looking at a flag football model that I think actually could be much more effective in terms of the development of athletes. Same for tackling and rugby. But actually, if you're looking at impact in sport, the single biggest policy change that I think we can make that'll be helpful in terms of preventing a lot of the long-term issues is banning heading in soccer. So again, for participants under the age of 12 and 14 is a better and safer number. They did this in the US in 2015 for context. They've put restrictions in the UK. We're behind the 8 ball on that in Canada. And we've tried to engage with Soccer Canada on this. So far, we have not been successful. But when you look at participation numbers, just for context, there's 750,000 sports soccer participants between the age of 3 and 17. By comparison, there's 550,000 for hockey. it is the single biggest policy change that we could make that would prevent children from being exposed to these non-concussive and concussive impacts that end up causing so many problems later in life.
Thank you, Tim. And I know you've also been working with the military as well. Did you want to speak to that a little bit?
Yeah, so I'm always, very reticent as a civilian to try and, make any recommendations of how the military should operate. But the way I talk about it is, speaking as a former football player, where we've seen a lot of success in football in reducing risk, is trying to reduce as much as possible the contact in practice. So what we figured out very early on in this conversation was 80% of the impacts that football players were receiving were in practice. And so figuring out strategies, to essentially eliminate contact in practice or reduce it dramatically, in theory, reduces your risk 75 to 80%. So for those in the military that are designing training courses, again, understanding that every impact comes with a cost will really help in terms of designing those strategies. And one of my colleagues, Dr. Jeff Brooks, did some very, very important research at Western University where he put accelerometers in the helmets of the varsity football team, and over the course of 5 years measured every impact that they received, both concussive and non-concussive. And what he looked at was the effect on reaction time. And when you're thinking about performance for an athlete or performance in the military, reaction time is often the single best indicator of that performance. And so what we saw was proportional to the impacts over time is that reaction time decreased. And we'd always hypothesized that going in the off season, there would be some sort of return to baseline. It actually doesn't happen. It just gets worse and worse and worse. So, if you're really trying to have this argument resonate with leaders who don't care about the ethics and don't care about the health, but just care about performance, Dr. Babel, you referenced the coach saying, I'm not here to protect my athletes, I'm here to win games. And the reality is certainly at the college level and the pro level that in a lot of cases, unfortunately, that's true. And there's people's jobs on the line. If you really want to get their attention, tell them if you smash your athletes in the head, they're actually going to play worse on game day because you're screwing up their reaction time. And for parents, that want their kids to succeed athletically, if you want your child to play in the NHL or the CFL or the NFL, same thing, don't expose them to subconcussive impacts because you actually will ruin their performance later on in life.
Great, thank you so much. Dr. Babul.
Yeah, so just building on what Tim was saying is that I think we need to tackle this from a top-down and a bottom-up approach. Policy at the government level, at the organizational level is one thing, but we also need to educate from the bottom up. Depending on who you are, what you need to know for this particular injury is very different. So physicians need to know how to accurately diagnose a concussion based on the latest evidence and guidelines. Parents need to know how to manage their child or youth's concussion. If I can just mention the concussion awareness training tool that we developed a decade ago. When we developed it, the impetus for that was the increasing calls I was getting in my office from parents saying, well, I took my kid to the emergency department, and then the doctor said he's fine. He's had his bell rung. Just give him a couple of days. Or the teacher doesn't believe he or she can't study. They think they're trying to get out of writing the exam. So what we did is we did a bit of an environmental scan to say what exists out there. And there was just a couple, and there was costs attached to it. And our provincial government said, if we want individuals to learn about concussions, we're not going to charge them. And then we did focus groups with various audiences and took all that feedback. So physicians, for instance, said, we want to know the most amount of information in the least amount of time, because we have a to-do list of about 20 pages. So that's when we built the concussion awareness training tool. And at that time in 2013, it was only built for coaches, parents, and players. And since then, it's grown to 8 modules because we know concussions happen to various different audiences. So those dealing with intimate partner violence, workers in workplaces, the film industry. So we've expanded and built the online tool accordingly. And it's really to educate all these different audiences on what to know in terms of prevention, recognition, diagnosis, treatment, and management, and has associated resources that are helpful for that audience. So I think we need to educate from the bottom up, as well as work with government top down to really increase the level of knowledge and understanding. And just as a side, we've been working with youth sport across the country. So 26 of the 52 universities and colleges have now mandated it for university high performance athletes. So just yesterday, I got a notification saying that 25,000 university athletes have now completed the online course, which is fantastic, because we have to make sure that they're not being heroes to themselves, to their teammates, to their coaches, you know, to their families. We want people to understand that it's your life that you're jeopardizing by not taking immediate action from stopping what you're doing, so that you don't have long-term consequences. So I think we need to go both ways, education and policy and legislation as well.
That's a great answer, Dr. Babul. And I also wanted to say I checked out the concussion awareness training tool, and I noticed that it's targeted at different audiences. There's 6 different audiences, and one of those is physicians. And I wondered if you could speak to sort of what that module is and what are the benefits of a physician taking that course.
Yeah, there's a lot of misunderstanding, and again, it's a lot of gray area. A comprehensive assessment will probably take about 45 minutes, but physicians in office don't have 45 minutes. So it really lays out what a physician needs to do, as well as it targets other multidisciplinary care, such as physiotherapists, what they need to do. If someone is having persistent dizziness, fatigue, you know, do they need cervicovestibular therapy for their persisting symptoms? Because you really need to target the symptoms that are persisting, and depending on what those symptoms are, really gives you an idea of who needs to help in the treatment and care of that individual. So it really walks you through assessment, diagnosis to treatment and management, and physicians upon completion of it can claim continuing medical education credits for it, because that was one of the feedbacks we got in the focus groups, for them saying, well, what do we get out of taking this course other than knowing what to do? Can we gain some educational credits for doing it? So we built that into the course as well, and worked with the Royal College to make sure that they got those CME credits.
That's wonderful. And I'm hoping that we can possibly share the link in the chat to the course. So Dr. Tartaglia, what would you say about what else you think Canadians or government leaders need to know in terms of brain injury and dementia for prevention or changes in policy, or anything else you would like to add?
Yeah, I guess there's 2 main things that I think are really important. One is, let's say, for people who have persisting symptoms, you really need a multidisciplinary approach. And actually across Canada, that is not covered by the funding bodies. And so, you know, when we usually prescribe that people rest for 24, 48 hours maximum. And afterwards, they need to get back into activities, you know, in a slow graduated manner, which includes physical activity, includes cognitive activity. But you know, they don't have access to physios. They don't have access to occupational therapists. They don't have access to psychotherapists. You know, mental health issues are huge in people who've had concussions. So those things are going to prevent them from doing the things that are going to help them, that are going to mitigate the risk that, you know, they've had this brain injury and that it is associated with dementia. And so these lack of resources, when you look at the larger economic picture, are, you know, basically, you know, it's pennies compared to having to take care of somebody who's demented. And, you know, the cost to the person, to the family, to the society. So, you know, investing in these kinds of resources, I think, is going to be essential. The other thing that I think is really important is to really use a targeted approach. And so, you know, I'm happy to hear that this, you know, these training programs are targeted, but it has to be targeted, like it has to be like that, right? Because right now, you know, when an older person, you know, 65 and older, let's say, has an event that could be associated with a brain injury, it's actually largely goes unnoticed, undiagnosed. You know, when people have dementia, we worry about urinary tract infections when they get agitated. Could you imagine somebody has a brain injury? They can't necessarily remember, tell you that they've had one. And we have really no tools right now for recognizing this. You know, I looked through a few years ago, over 1,000 referrals. I have like tons of referrals. There was less than 1% for people over the age of 65. That doesn't even make sense. They are the largest growing population of our society. They have many events that are associated with brain injuries. How could this be? And there aren't that many clinics doing persisting symptoms of concussion. So I know I get a lot of patients. So I think we need to recognize that this is a problem. And for prevention, I think equally, we need to target, you know, we showed a few years ago that young people versus old people had different mechanisms of injury. Males versus females had different mechanisms. Old males versus young males versus older women. So we really have to be targeting our prevention programs so that we reach the right audience. I mean, I think the smoking and alcohol usage in women is really kind of scary right now, but you can imagine that a lot of the propaganda towards all the, you know, I guess the health, the detrimental health effects of these things were in campaigns that were really addressing men. And so women, I think, did not feel so targeted. And when you look at the statistics, it's kind of, you know, mind-blowing to see the number of young women who are smoking and drinking right now.
Mm-hmm. That's great. Yeah, thanks for highlighting the male-female disparity again. You linked right back to that earlier discussion. You also mentioned, Dr. Tartaglia, sort of the economics of the issue, like it costs pennies to treat and versus the societal gain. I know, Tim, when we were talking earlier, you had mentioned some work that your agency is doing with McMaster University with a health economist. Would you like to speak to that a little bit?
Sure. So we're trying to look at the military populations right now. The Canadian Armed Forces do a very good job of documenting injuries, and so we feel like we'll get some very good data there. And then, you know, trying to look at how people progress. And Dr. Tartaglia referenced mental health. And so, you know, whether it's PTSD or their mental health issues, very well documented in the veteran population, and certainly huge costs associated with that. And what we're trying to figure out is, you know, what part of this is associated with brain injury. And if you start to create those physical treatments and multidisciplinary treatments that look at the brain injury component, you know, can we start to see these cost savings realized? That for all of us that are sitting on the front line seeing this just seem very obvious, but we need to do the work to get the data to back that up. And I'll just make a general comment. You know, for our group, we've used a lot of Dr. Babel's tools before, and you know, have worked extensively with Dr. Tartaglia. She's helped out a number of people that have come through our helpline. And she works closely with our research partners at CAMH, you know, who are the odds-on favorite globally to be able to diagnose CTE in vivo, which, when you're looking at that component of things, is really the most important factor. And so I think, as a very proud Canadian, having recently attended the Amsterdam International Conference, it's unbelievable the work that's being done here in Canada. We have so many people that are doing such great work, and, you know, perpetually under-resourced. You know, we're small compared to our neighbors to the south, but we're doing really, really strong work. And, you know, Canada in a lot of these fields is leading and has the opportunity to lead the world in this work. So I think, you know, for all Canadians that are affected by this issue, I think there's probably some comfort in that. And, you know, certainly proud to be part of that, and just, you know, could not recommend the Concussion awareness training tool and the work that Dr. Tartaglia is doing enough.
Amazing. Thank you so much, Tim. And just wanted to give each of our panelists one last chance to add anything else that they want to add before we go to the question period.
Can I just make one comment? I mean, you can see from the discussion the challenges related to this injury, not just from a concussion standpoint, but from a healthcare standpoint as well. But I also want to make note that there's a lot of private clinics that have popped up across the country, many of which are unaccredited, and charging exorbitant amounts of money that is needless. I had one family say to me, it's cheaper for me to fly to Winnipeg to get treated at the Pan Am Concussion Clinic there than paying this one particular clinic here what they were charging. So I want Canadians to be aware of that as well, is that you don't need to be paying ridiculous amounts of money at these private clinics. Try to find, a reasonable healthcare professional who's willing to treat you and manage you in a multidisciplinary in a multidisciplinary fashion. So I just wanted to make that note that there are a lot of people are capitalizing on this injury, and to just be wary of that as well.
Okay.
Yeah, I fully support that. I'm so happy you brought that up, because some of these people are preying on our patients who are vulnerable, who feel, unheard. As we all know, our healthcare system is fantastic, but, does have some limitations. And so, these quick fixes, these, non-evidence-based therapies, I often see that patients who have spent exorbitant amount of money or used up all their insurance claims on these therapies, and then are there suffering 2 to 3 years later, financially ruined, and not better. And so I think actually that is something that has to be taken up at a higher level, because there is, just like there's very little oversight of nutraceuticals in our country. If you call yourself a nutraceutical, the bar is way lower than if you call yourself a drug. The same thing for these clinics. There's very limited oversight of them. And it's a huge issue for patients.
Yeah, agreed.
Wonderful. Great point. Great point. Tim, you look like you wanted to say something else. Am I reading that right? Or did
happy to. So just to take this a step farther, for the three of us on this panel, as we work and we try and advocate, and we work with governments and industry and other funders, the more support we can get from the general public, the easier that conversation becomes. And for us, particularly with our work in the military with Project Enlist, but for all Canadians, for people that sign up at concussionfoundation.ca and pledge to donate their brains, that's a very, very powerful number when I go and sit with those people, because if somebody cares enough about the cause that they're willing to give a body part, and I'm not asking anybody to do anything that I haven't done myself, which is, I will be donating my brain to science when I pass. You hear all the time from athletes and soldiers, if it helps, the people that we're leaving behind, and happy to do that. And for Dr. Tartaglia and her work at the Canadian Concussion Center, and that also have a brain donation program, the more that the public can engage and get involved with that, the easier it makes our job as we're working and trying to get more attention, more resources, and more funding for this issue.
Wonderful, wonderful. Thank you so much. I wish we had another few hours to talk. We can learn so much from all of you. It's time now to turn to our audience questions. So we have a question here from Claire. Thank you so much for this so needed presentation. How do we recognize mild traumatic injury in older persons that have fallen and are currently delirious, which is a large share of older persons arriving at the emergency department, for which I cannot find a systematic process to diagnose mild traumatic injury and refer to the appropriate care in my institution? Whoever wants to answer that.
Maybe I can start. I do have a research program, actually partially dedicated, well, I have a research program, and some of it is dedicated exactly to this question, because a lot of the tools that we use today to figure out, because, concussion is still a clinical diagnosis, right? We don't have a test, no tests available. It's a clinical diagnosis. A lot of those tools actually don't work that well if somebody has any cognitive impairment. And so if your baseline is impaired, the tools don't work that well. If you don't remember that you had an injury, they obviously don't work that well. So that's a great question, and actually an active area of research, because I don't have the answer. You know, we try to do outreach to family doctors, you know, to families, to think of, you know, if you see unexplained bruises, you know, if something is changed, you know, we often say when people, because I have a dementia clinic, if things change, we often say, you know, they need to check their urine, do they have a cold? Well, the other question is, did they have a fall? Did you find them on the ground? You know, did they have some brain injury? So I think it's going to take a lot more work to figure out what is going to be the best way to detect mild brain injury in people who are older, and also people who can't tell you that they've had one.
Okay, great. I think we have several questions. Is it okay if I move on to another question, or did someone have something pressing to add to that one?
Well, I just say very quickly, you know, advocacy of caregivers in this case, and you know, when you see the Miami Dolphins quarterback with millions of people watching, and they're still screwing up the diagnosis. I mean, when I watch that, my reaction is, well, what does that mean for the 13-year-old soccer player down the street, or the 70-year-old woman who falls on the ice? Right? We miss 80% of these injuries. But if you become trained in this, which is, you know, anytime you see any sort of fall, or, you know, one of the signs, as Dr. Tartaglia said, is, you know, bruises or lacerations, you know, that somebody's had a fall, immediately the mind should go to brain injury, and immediately it should go to other mental health consequences and some of the other things that are involved with this. And where it can be really challenging is for patients, when you're dealing with your caregivers and your healthcare professionals, is they may not be up on this stuff. So it really comes down to the advocacy of particularly the caregiver, because, and I actually stole this line from Dr. Tartaglia when she presented at one of our events, but asking somebody who's had a brain injury to self-diagnose is a terrible strategy. And so, you know, it really comes down to that bystander model. And what I would say to anybody who's a caregiver who's listening on this phone or listening to this call is don't be shy to really push, because, you know, where there's smoke, there's fire.
Wonderful. Okay, we have a question from Jeanette. I suffered a concussion November 2018, and ever since I've developed major sleep issues, up every 2 hours, sometimes every hour. I've also developed sleep apnea and continue to experience headaches. No one seems to be able to help me, and I'm very concerned about dementia as well as lack of oxygen to my brain. I've been recently told by a neurologist in Ottawa that I can only go on medication. There's nothing else to help me, as I've done everything else. This has changed my world upside down, and I find it so hard to function. Please help, I'm desperate.
Okay, well, I would say that I actually agree with this neurologist in Ottawa. If somebody comes into my clinic and they had symptoms for over 4 years, I'd say, we've given the brain time to heal on its own. It's time to, you know, really like hunker down. I think the main goal for all of us is to get back to our lives. And, you know, I would hope that if somebody said they had diabetes, that your reaction would be, you need to get on insulin, you need to take something to control that. Well, the same thing for, you know, a brain injury related symptom. They need to be treated. Poor sleep means that people get headaches, people get low mood, they can't concentrate, their memory is bad. You know, we talk about this vicious cycle that happens in concussion is, you know, you develop like persisting headaches, which makes your sleep bad, which makes your concentration bad, which makes your memory bad, which makes you depressed, which makes your sleep worse. And so we need to do something to get one of those gears. Untreated sleep apnea is not good for the brain. So you really, you know, you want to get that sleep issue looked at carefully and treated. And I'm not talking about benzodiazepine treatment, but there are treatments to help with sleep. Yeah.
Okay, great. Do you feel the changes in helmet standards over the years has decreased injuries? I've heard of inflatable helmets. Is this a thing, and does it impact the potential injury?
So as a guy who wore a helmet for years and years and years, I'll take this one. So helmets were designed and are really good at preventing skull fractures. They are not designed to keep the brain from moving around in the skull. And so, I don't think we ever want to discourage innovation, but, in the short term, helmets are not going to be the solution to this problem. So again, really good at preventing skull fractures and facial lacerations, but not good at preventing brain injuries overall. And so, particularly speaking of hockey, football, other sports where you wear a helmet, important to wear them, to prevent skull fractures, but the solution is, again, much more what we were talking about earlier, which is changing how you practice and then not exposing children to concussive and non-concussive impacts before the age of 12. And we recommend 14.
Okay, great. Oh, sorry, go ahead, Dr. Babu.
Yeah, if I can just add to that, there's this misconception out there that helmets will prevent concussions. And as Tim said, it's not going to prevent a concussion, because a concussion is really the bouncing around of the brain inside the skull. The helmet will potentially mitigate the severity by absorbing the energy on impact, but your brain is still going to bounce around inside the skull. And I know Bauer React had a lawsuit against them because they came out with a newer helmet with a detachable inner lining. It was touted as a concussion-proof helmet. A son got a significant concussion and the parents sued Bauer and they had to change their tagline. So there's no such thing as a concussion-proof helmet. I just want that to be clear out there, because there is this myth that if I wear a helmet, I won't get a concussion.
Mm-hmm. Absolutely, yeah. And I've spoken to several people who have had severe brain injuries from biking and they were wearing a helmet. So yeah, true. Do you know, we have a question from Ashley. Do you know of any formalized approach like social prescribing in the health sector to support the health and wellness approach to those with brain injury? I'm not sure what Ashley means here. I wonder whether it's maybe prescribing social interaction because there's a lot of isolation in brain injury.
So that's one of the things that we've done. So we launched our helpline service for North America in 2019 and have seen over 5,000 inquiries. And one of the things that we've created on the back end, and I'll credit one of the women on our team, Taya Lafort, who's really driven this, but having peer support and participating in support groups has been something that's very, very helpful for people, and socialization in general, right? If somebody has a brain injury, one of the worst things you can do, whether somebody's healthy or not, is put them in a dark room and not have lots of human contact. It's a very important part of this. So yes, those strategies have worked very, very well and have certainly helped people that are suffering from brain injury. And for the purpose of this conversation, caregivers for those with dementia.
Wonderful. Okay, we have another anonymous question. I've heard of optometrist assessment tools and post-concussion therapies to aid in the recovery process. Do you have any thoughts to share on this?
I think when somebody's undertaking any therapy, and I mean any therapy, whether it's drugs, whether it's physio or occupational therapy, I think you want to think of what we call evidence-based therapies. And that means that they've been put through very rigorous scientific trials and shown that they would be good for improving your outcome. That is not actually the case for much of vision therapy. And so I think it's really important, I don't know all of them, but there actually are some really good reviews out there, which I will share. And, maybe there's some way for them to share with you guys on the evaluation of vision therapy for concussion, because the evidence isn't great right now. There are people who are actually actively looking into this. So that doesn't mean there won't be something great coming up, but what's available right now doesn't have the evidence that we think is the standard for how we prescribe things to people.
Okay, great. We have a question here from George, who has a 75-year-old wife, and she suffered 3 concussions 5 to 10 years ago, and she now has symptoms of Lewy body dementia. And his question is there any possibility of recovery or improvement?
Yeah, so I think his, the question of the concussions happened a long time ago, and Lewy body disease or Lewy body dementia is due to a different type of proteinopathy. This isn't CTE. So the issue is, did the concussions actually anticipate or accelerate the timing of the onset of the symptoms? We don't know. There is a little bit of evidence to show that yes, but I'd say that the treatment is really going to be aimed at the Lewy body dementia treatment disease. And so whatever the standard is for that, there are, some drugs that we use and some physio, but the recovery, that's a progressive neurodegenerative disease. So we don't expect recovery. We do expect that it will progress. Now, if somebody with Lewy body disease has a fall and gets concussed, then of course they'll have a period where they're worse and they can recover from that. But from a concussion that happened many years ago and that one would think they had, recovered from, I don't think so. Yeah.
Okay. Are people who experienced longer lasting symptoms for months or years or after concussion at greater risk of dementia than those who recovered more quickly from a brain injury?
So I don't think we know that, but I'll tell you one thing. I see a lot of former professional athletes, and a lot of them tell me that they recovered, very soon after concussion and had no persisting symptoms. And some of them, when they die, let's say they develop dementia and everything, they have a lot of pathology in the brain. So I'm not certain that it's I think we have to find a marker to detect this. It's not just going to be based on what we think is going on. Because actually we don't know this at all, whether having longer lasting symptoms puts you at higher risk of dementia or not.
Okay, thank you so much. Dr. Babel, I think this one might be for you. How can the patient find out how evidence-based or accredited a concussion clinic, in quotes, is with good evidence-based assessment, care, and follow-up?
I think it's an easy question to ask the clinic. Are you accredited? There's on the concussion awareness training tool, there is a resource on there which guides you through what to look for when going through a concussion clinic, what you can ask them. So I encourage you to go on there, go to the resource section, and it should, in the search bar, just put that in, accreditation or concussion clinic, and it'll provide you with the one-page document on all the information you need to know for that.
Great. And I think we have time. It's 12:59. We're going to cram one more question in here from Val. Do you have a suggestion for an elderly senior with ongoing traumatic injury symptoms living in the Vancouver area to go for help? I do not feel that my doctor takes my concerns seriously. It's hard to navigate the system.
This is a challenge in BC. We have very limited, we have one publicly funded concussion clinic, that's GF Strong, and it primarily deals more with moderate to severe traumatic brain injury. It does deal with concussions, but on a case-by-case basis. We are working to try and establish a provincially funded concussion clinic, but we're years out. So perhaps, Annalise, if you can email me that question, I can do a little bit of looking into it and get back to this individual. Yeah.
Sure. Thank you so much. Well, that's all we have time for today. Thank you once again to the panelists and for the viewers for your participation in today's talk. I think we probably could have gone for another hour and still not run out of questions. So just so you know, the recording of this session will be posted on the Alzheimer's Society of Canada's YouTube channel in the coming days. And you can follow Alzheimer's Society of Canada and Brain Canada using the handles shared in the chat to get an alert for when the recording has been posted. Thanks again so much for joining, and have a great day.